Chapter 4. Dissociative Amnesia. Dissociative amnesia is just one of several dissociative conditions that psychologically separate an individual from some aspect of their self, often following trauma or extreme stress. In the case of dissociative amnesia, people are separated from their memories, suffering unusual amnesia in ways in which substantially disrupt their lives. They might forget a specific event, or they might forget who they are and everything about themselves and their personal history. The individual might or might not understand their amnesia, though they might appear puzzled. Unlike the ones who develop medical amnesia after an injury or stroke, however, somebody with dissociative amnesia seldom shows concern about their condition. It's approximated that 1.8% of American grown-ups experience dissociative amnesia in a given year. Signs. Dissociative amnesia is not typical forgetting, like misplacing secrets or forgetting the name of someone you met once or twice. Signs vary from forgetting personal information, like an individual's own name and address, to blocking out specific terrible events or even the events of a person's whole life. An individual with dissociative amnesia may not remember friends, members of the family, or colleagues. When an individual with generalized dissociative amnesia forgets every little thing about their self and their life, they might transfer to a new area and establish a new identity, but when discovered, they don't know how they arrived or why they have no identification. Most cases of dissociative amnesia are temporary, but memory spaces can last everywhere from several minutes to a whole lifetime. Those with dissociative amnesia might be at greater risk of self-injury and suicide. The DSM-5 includes the following symptoms for dissociative amnesia: the failure to remember crucial autobiographical info that one would generally be able to remember. The forgetting causes distress in everyday life, which includes at work, school, or with loved ones. The disruption isn't due to substance use, a different psychological health disorder, or any other health condition, such as a seizure or brain injury. Causes: past of recent trauma, abuse, mishaps, or extreme tension, like from a war or natural catastrophe, either observed or experienced, can cause dissociative amnesia. There might also be a genetic link, simply because people with dissociative conditions sometimes have family members with the same condition. While these signs might be similar, dissociative amnesia is not the same as amnesia resulting from brain disease or damage. Though, scientists have recognized unusual changes in brainwave activity in people with dissociative amnesia that could cause a better grasp of distressing memory loss and more reliable disorder-specific treatments. Treatment. While there are no evidence-based treatments particularly for dissociative amnesia, psychotherapy and other forms of treatment, like cognitive behavioral therapy and dialectical behavior therapy, are typically used to deal with the disorder. Strategies such as hypnosis and drug-assisted question-and-answer sessions may help spark the capability to retrieve memories, which can help clients understand how trauma may have triggered their amnesia, disrupted their life, and how to fix their concerns to help prevent more trauma in the future. Clients with anxiety or sadness can also take advantage of medications that target those conditions.